She's right motor dominant. She's got the short right leg, so everything's proven out. Which side of her body would be her stabilizing side? Her left side, right? It'd be her left side. So if it's her left side, what does that say about the muscles on the left side of her body? They're probably going to be a little bit tighter, a little bit firmer, because that's stabilizing so she can operate that right side. So the pattern is, for most of us, unless we're a little different, which there's those people out there that are different, most of us that are right motor dominant, your right side is usually going to be more flexible, more less contracted tissue compared to your left side, because the left side is stabilizing, trying to hold you so you can do stuff with that right side. Okay, so hamstring left side being a little firmer, that makes sense. Okay, now I'm going to check the piriformis. Piriformis. Anybody can tell me how to do that? Or I haven't really talked about it.
Reach across the left.
Okay, I'm just going to bring the knee up, bring this leg over here, and now I want to come over here, and I'm going to hold that SIS, and I want to go over. Actually, I'm going to do this, and I want to go over until it stops. So I got right here. Okay, now that tells me, so I get here, and there's, feel that, and that's where I get. Okay, that tells me external rotators, piriformis is one of those. There's, 5 different external rotators, Gemellis, obturator internus, and what's the other one? You remember?
The 5.
5 external rotators.
What were the ones you said?
I said Gemellis. You got Gemellis superior, inferior. You got the obturator internus, piriformis. One more.
Is it iliopsoas? Is it the?
Make a guess. We're amongst friends.
Oh, I know. Is it the iliopsoas or?
Iliopsoas?
No.
Iliopsoas. Well, that's not the 5 that I'm talking about that are right here.
Oh.
Right there. Underneath the glute, max, min, medius. Underneath those. Some of the little. Well, that's one that you can tell me later. But you know 4 out of 5. Okay. So now I'm going to come over and check this side. Whoops. This side. And so let's see. Now, according to my patterns, which side should be less flexible than the other? The left side. See if that makes any. Yeah. She's showing this pattern just like it's supposed to, because what I'm feeling for is when I get here, when does this start pulling up on that ilium that I'm trying to pin to the table? So I get here, and now as soon as I start moving, it's like, oh, I want to go with it. So that side's, I know, nice and stable. And this is a good thing because the brain's looking for stability in that low back. So having a tight side is not a bad thing. We don't want to work that out. Well, we'll work a little bit, but we're not going to, because hypermobility is not good in low back and pelvis, right? Because we want this stable, because this makes the foundation for everything else. Okay? So if this is real loosey-goosey, it's not going to be good, because these muscles are going to have to compensate, contract and hold that contraction forever if you have one side a lot looser than the other, because we want some stability right here in this horse. Okay? See this making sense?
Yeah.
Okay, so that's, I just got my piriformis, which once again is the left side. Now I'm going to do adductors. Adductors here, I'm going to come over here and I'm going to, once again, I'm going to pull on this, push on that knee and see how soon it hits that pelvis and makes it start moving toward me. That side, pretty tight, doesn't like to move a lot or stretch a lot. That's got a little stretch to it. Okay? So I want you to come and feel these. I want you to come and feel the piriformis